Good morning, and as usual, Indigo on time. Thank you. It was a very insightful speech, a lot more that we can get to know about Indigo and your help to India. So thank you so much. So now, when I was given the opportunity, first of all, a big thanks for getting me here to in front of bright youngsters, to talk about my journey and the journey as we disrupt, in the healthcare space. So I can tell you one thing, GenWorks itself is a disruption. And, I can tell you for sure, I'm the one who's embracing this, disruption, for democratizing healthcare. So, and I'll tell you how in the next 40 minutes. Now, all of us know healthcare is essential. There's nothing about healthcare, that it's only available to a set of people and not available to the rest. So at this point, it's underserved, and definitely in the Tier 2, Tier 3 geographies of our country, it truly is underserved. And it's underserved not because of any other reason other than the fact that, we don't have specialists in most of these geographies. We don't have access to reliable, quality, and affordable technologies in most of the geographies. And we can keep complaining about this all our life. And this is when, GE decided to disrupt. 10 years ago, GE Healthcare, and I'm a very long tenured, GE employee for many years before I moved into GenWorks. 10 years ago, GE made the decision to change its outlook to markets as in India. And in fact, they did it by, stating a mission, restating their mission, we had worked for healthier India. And when they said that, the first thing they did was to look at, the technologies that we have, and using those technologies and innovating to make sure that we have the best-in-class technologies available at a price that is affordable. That was the first step. The first step was to bring products at the level of quality that GE is expected to deliver at affordable prices. And they did it not by cutting costs, they did it by creating relevance to markets, relevance to provide access, to a lot of physicians is the first thing that they did. And when they did that, they brought in a lot of products which were made in India for the world. And but still, these products were only going to the metro and Tier 1 customers, because our distribution was limited to the metro Tier 1 customers. And we had, of course, distributors who were small in scale, but not sustainable distribution, who could make an effort to go and get customers to adopt technology. So 5 years back, there was a decision taken by our CEO, Terry Breshenham, to create innovation in distribution. And through the disruption that she wanted to make healthcare affordable for all, she created GenWorks, invested company of GE, and asked me to lead it. And if you want to know why I was asked to lead it, I can tell you one thing in GE. For a lot of people who want to join GE, I can tell you one thing is a surety for you. Any good work is definitely punished with more work. And I had a reasonably good tenure in GE, successful tenure in GE, and they asked me to lead this challenge. And when I'm given a chance to lead, I taken a lot of people along with me. I brought in a lot of people. One of them is here. So we created a company called GenWorks. 60 of us moved to GenWorks from GE, and we are now 350 people in the last 4 years. So now that's a small brief of what is GenWorks and what we are doing, to embrace disruption to democratize healthcare. And because healthcare has to be universal, it cannot be for a few who are lucky. And even for the few who are lucky, how efficient it is a factor. For some, it's available, and for those who are available in our country, how efficient it is. And when I say efficiency, it has to provide early care, it has to be affordable, and it has to get you back to normal life very soon. And that's the responsibility of delivery of healthcare. And this is how, and most of you know this, this is how healthcare is. It truly is a personal experience for all of us. And I'll share with you some interesting personal experiences as well in my journey, not necessarily in the organization where I work for, but also my own personal experiences. Because I deal with healthcare, and I have to be, even at home, I have to take care of healthcare of me and for my family. So look at healthcare in its perspective. Healthcare is delivered in clinics, in hospitals. It's delivered by specialists. It's got diagnosis as an element. It's got monitoring as an element. It's got treatment as an element. All of this have to come together. And all of this has to come together to make it effective and efficient. I'll share with you a few personal examples. Not long ago, it was about 25 years back, I had a personal experience. Well, there's been a lot of great help that I've had through the healthcare delivery system in the country. But there are a few which I want to bring out for you to just connect to what's needed to be done to truly make it transformational, to truly, because when we democratize healthcare, we are going to create a lot more as a problem to solve. And because the net is going to be wider, and we need to really focus on not just going and selling products or building hospitals or building nursing homes or building physician offices. It's also about how efficiently we should deliver. In that context, I thought my personal stories would truly help. 25 years back, I was in the healthcare. I just started, I think I was few years, 3-4 years in my career. All my life I was in healthcare. And I was sitting in the office after lunch, after a good lunch, and suddenly I had a chest pain. I was 26 at that time. Chest pain radiating in the left arm, with my whatever knowledge I had of healthcare, was scary. So I turned around and I told my colleague, I'm having this. And obviously, he was concerned, and I was rushed to a reasonably big hospital those days near our office. I was immediately sent to the emergency. They took a ECG. ECG has been an electrocardiogram which looks at how your heart functions. That's the first thing you do when you have a chest pain, or if you want to have a look at how healthy your heart is. I was taken to the emergency. The ECG was performed on me, and I could hear them saying something. I could hear them saying that left bundle branch block, was what was seen through the artificial intelligence that was provided those days by those equipment providers. And even in the metro, it was in Chennai. Even in metro, I was in the heart of the city 25 years back. There was no specialist available in the hospital 24/7. There was a duty doctor who was a youngster, who was learning, and I would not fault him at all. He did what best he could do. But I was diagnosed to be, having a myocardial infarction. And I was put immediately through a thrombolization. And, I was in the ICU. Before the specialist came in, much later, all this what I said happened around 2 o'clock in the afternoon. The cardiologist came in at 10:30, and when he came for rounds, he did an echocardiography, and he looked at the reports, and he said, it's fine. Why did he have to go through all this? Just look at the emotional trauma at 26-year-old. My daughter's naming, my first daughter's naming had to be in the same week, a few days ahead, and had to go through this. And thankfully, the cardiologist came in, and he got me out of everything. put me on a treadmill and on a Bruce protocol, which is a difficult to do treadmill. I'm sure most of you guys do it anyway in your gyms, today. I had to go through this. Why? Was there not a hospital? Yes, there was a good hospital. Yes, there were specialists. Yes, there were equipment. Yes, there were even equipment which could give interpretation those days. But a collective judgment, an ability for a specialist to have a look even when he's not there and stay connected to the patient, not just rely on what was available as the resources there, was a problem. Thankfully, I got out of it. And even 15 days back, I did a treadmill, and they still say my heart is healthy. So that's how, that's one personal experience. I'm just saying these stories just for you to have a connect as to how and why. It's not just about expanding healthcare access. It's not about expanding technology adoption. It's about how we optimize and make delivery efficient is the key. I'll tell you another experience which happened 5 years later. We were all having dinner at home, and my mother suddenly, fainted. And we were worried, and she got up by herself within a few minutes. And we took her to the neighborhood clinic. Ideally, an ECG should have been performed on her. There was no technology, they didn't have an ECG machine. And instead of asking for an ECG, the doctor decided to treat, eat on a more conservative basis. And we came back and had to rush her to the hospital because, and then we came to know that she had a heart block. Because we took her late, she had to go through further complications and had to struggle for 6 months in the hospital, and then she passed away. They look at a scenario as this. We face this every day. We face this every day. This is a physician in the heart of the city. When we went with the problem, and can we comfort ourselves saying that you're not lucky? We would not, and I was in the healthcare industry. And even recently, I can tell you, while this problem to a large extent is solved over the last 20, 25 years in the metros, my dad lives in a village, not far away, 70 kilometers from Chennai. And around 1 o'clock in the night, he called me and said that he's feeling breathless. And immediately we rushed him to the nearby hospital in Kanchipuram, a 24/7 hospital. And I was in Bangalore. I needed 5 hours to reach. Indigo does not operate midnight, so I did not have the luxury of taking the flight midnight. I had to go the next day morning or use, none of the airlines operate in midnight, so I'm not blaming Indigo here. So, but when I asked them what they said, it's in a very serious condition. My brother used to work in Malaysia. They said he's in a very serious condition, acute MI, and they did a ECG. They said it's an acute MI, and they said, please inform relatives. We're trying to stabilize him. And when I sent an ambulance, thanks to my friend who runs a hospital in Chennai, a leading hospital in Chennai, he was brought back. He was brought to Chennai, and they said it didn't seem like an MI. Then just because he was 75 years, they had to put him through a lot of tests, including the angiogram. And everything was fine. For a 75-year-old, his heart was very, very healthy. There was no block anywhere. And what was the diagnosis? The diagnosis was sleep apnea. It's because he had an obstructive airway disease. He couldn't sleep well and for many days. And then probably that at his age with a little bit of nervousness, he stays alone with servants because I'm in Bangalore and he's there. And why I'm saying all these 3 things is, one, when you have access to an hospital, when you don't have specialists, you still are not lucky. You may have technology, you may be in a hospital. If you don't have the specialist around, it's a problem. So if you really see the issues that we face today in healthcare is about late or incorrect diagnosis. It's about affordability, because when we rush at the time of treatment, it certainly is unaffordable. Availability of specialists round the clock. Even in the best of the hospitals, availability of specialists round the clock is a problem. And in the tier 2, tier 3 towns, availability of specialists itself is a problem, because specialists are more. 80% of the specialists are available in the 20% of the geography. So there's a problem that we need to face. And of course, availability of access to diagnostics and monitoring technology. So in all of this being there, if I need to broad-base healthcare, if I have to look at democratization of healthcare, and our Prime Minister is doing it through Ayushman Bharat program. This is the first step, to democratize healthcare and improve healthcare access. If we don't correct this, we're going to be in for more trouble. So that's where GenWorks or the GE's decision to create an organization called GenWorks makes a big difference, because our fundamental focus over the last 4 years has been to improve in each of this area. We have been trying to increase technology adoption in clinics. We are trying to leverage the cloud and the internet to be able to connect specialists 24/7 through hub centers who can read and report and also guide the hospital to manage the patients efficiently. We are through a lot of education programs, improving knowledge levels, not just at the level of specialists, at the level of doctors, at the level of paramedical staff, and everyone in the system, who's in touch with the patient, when he's in dire need. We are promoting very, very actively early intervention. I'll tell you how as we move on. And it's all about enabling technology. My personal belief is technology should not make healthcare cost more. Technology should make healthcare cost less. And that can only happen through connected healthcare, and I'll explain you how or what we've been doing about it. We believe in liquefying expertise because specialist is scarce. We need specialists are available in limited geography. Thankfully, internet can connect them. Our mobile devices can connect them. When we connect the devices to the equipment, mobile devices to the equipment, we'll be able to have 24/7 access to specialists. And of course, I fundamentally believe digitalization and artificial intelligence, as it evolves, I won't say at this point in time, but as it evolves, is going to be a big help. So just to give you a context, I gave you a personal context, but the large statistics, we deliver about 30 million babies every year. Our infant mortality rates and our maternal mortality rates are one of the highest. It's coming down, definitely. A lot of efforts by the government, initiated by the government for institutional deliveries, is really getting these down. But infusion of technology, training, ability to intervene early, move from treatment mindset that we are all set to a screening mindset right from the time the baby is born, as it grows, for the mother when she is pregnant. All of this is really going to make the change. Our problem remains, as we say that, as we want to expand healthcare, our problem remains compared to the world median. The number of physicians we have for the population is less, and that also drives the number of paramedical staff we have is less, and that also drives the number of hospital beds. Every hospital bed is expensive, and it needs specialists, it needs paramedical staff. It's a complete ecosystem. Now, can we do something leveraging technology to disrupt this? Can we bring in a little bit of home health? Can we, by early health, can we avoid the emergencies and the visits to the ICUs? Are things that we are trying to change as we progress. So fundamentally, it's all about this. We have everything, and we have the patients. Now, how do we connect everything? Efficiency will come in only if we have connected healthcare. I told you about my problem. If only, just look at it as what I said. If only there was 25 years back an ability to connect my ECG to the cardiologist who came in much later, I could have been avoided, saved of the thrombolization or the ICU admission, because you would have seen it. You would have understood, you would have interpreted it better. And today, we have technology. Those days, we did not have cloud. We did not have, the mobile communication as robust and efficient as this. But today we have. But are we embracing? Are we doing something to embrace this? Are we, as a healthcare company, building this out for the customers to use it? And building it out is one. And are we able to make them adopt this is another. So that's clearly one thing. And how we are going to not just look at a care area view. A care area view is, if I have a heart problem, I go to a cardiology department, and within the cardiology department, they will look out for my heart and they take care of my heart. Is that the way healthcare has to be delivered, or it has to be more driven by a care cycle view? A care cycle view starts with the patient, because it's all about us. It starts with us and how early I can be screened, how quickly I can, and effectively I can make a diagnosis, and how I can treat early. And all of this will bring down cost of healthcare. And I said, a digital platform is core. A digital platform is core to connect all of this, because these are not all available at the same place everywhere. Yes, in some places it is available, and in those places it's very expensive. So now, if we have to bring down cost, we have to bring efficiency, and efficiency can happen through digital platforms. Efficiency can happen through business model innovations, adoption. Adoption rates can only become better if we have a business model innovation. I'll share with you a few of the examples. And fundamentally, it's all about broad-basing affordable healthcare. And broad-basing affordable healthcare is not at all possible without expanding technology access. It's about expanding not just reach, it's about expanding technology access, availability, and supporting by connecting the entire ecosystem is the way forward. So now, how are we doing this? The last 3-4 years have been very interesting. Prior to that, 15 years serving in GE Healthcare, and even before in Philips. Yes, we were selling technology. We are bringing in equipment into India, made anywhere in the world, and we were marketing it. We were making the first inroads, to enable adoption of technology to be able to intervene better and to improve the outcomes. But in the last 3-4 years, what we have done is significant. It's very significant because we have taken the mantle of also, connecting healthcare. We have GE as a company, or most of the big healthcare healthcare companies have products more aligned to diagnosis and treatment, and especially in India, because our mindset itself is treatment mindset, and only the diagnosis companies and treatment companies are popular here. There are phenomenal screening technologies available in the world. They don't even look at us as a market, because they think that who will pay for screening here, versus obviously we will find a way of paying for treatment, or we'll find a way of paying for diagnosis. Insurance companies support, government schemes support, but who will pay for screening? There is no insurance company or no government, or it has to be out of pocket. So who's going to do that? And especially screening is at a time when you don't seem to have a problem. When we don't have a problem, we assume that we are healthy, and that's where all the problem starts. So that's where we made the effort to complement the robust portfolio that we have from GE in diagnosis and treatments, and to make it more efficient, we brought in complementing technologies in screening. And I will share with you 2 significant things which we could accomplish through that. Of course, a lot more is being done, but I can share with you, in the interest of time, I will share with you 2 very interesting facts. We partnered a year back with, first of all, we built a connected tele-ECG solution. And having been impacted by ECG myself, the first thing we did, was to build a tele-ECG network. And how did we build this? G Healthcare has ECG equipments. They are one of the best-in-class ECG equipments in the world, which is known for its accuracy and early diagnosis. But an ECG machine is only an ECG machine. It can throw reports, but who will interpret this? And do we have specialists, across the country available 24/7, to interpret this? We don't. So we decided to partner with a large cardiologist network who would read the ECG for us. And we connected our ECG machines to this central hub, and through which within 5 minutes we train a paramedical to just place the lead. I'm sure most of you, if you have gone through an ECG test, you would know that it's all about placing leads and acquiring the electrical signals of the heart and interpreting them. So a paramedical can be trained to place the leads, and then all that he or she needs to do is to press the button. The ECG is transmitted through the cloud to the hub center, which is interpreting this, and within 5 minutes, the report goes back. It's just not the report going back. It's also about if the ECG is abnormal, the hub center takes the responsibility to call back the client anywhere in the country. We have got this connection going. The hub center is in Bangalore, and we have installations in Northeast, where at any point of day, 24/7, if thankfully with the availability of internet everywhere, they can connect, and here we can interpret. And if there is a problem in the ECG, somebody will call and tell the paramedical staff or the duty doctor, to stabilize the patient, and also find the nearest large hospital from where an ambulance can be sent and the patient can be pulled in, for intervention, early intervention, leveraging the golden hour. If it's an acute emergency, golden hour determines success rates. It's not even about how good the doctor is or how good the hospital is. How early you intervene determines that, and we are able to do that. And now, this is not only for the remote Northeast. We found value for this in our town, in our city. We partnered with Apollo Hospitals. Now, Apollo Hospitals for long, was excelling in cardiac treatment. And they changed their vision from being the best in class in treatment to be preventing. Their new slogan, I'm sure if you see the billion heart beating, they're talking about prevention. And when we saw them realigning themselves to prevent an event and not just treat, obviously they are already equipped to treat. So now to prevent, when they moved their focus, we went to them and we said that we have this solution and we can do a pilot with you. And I'll share with you the pilot results. For the last 1 year, we started the discussion. Last 6 months, we've been piloting with them. We did about 7,700 ECGs, where the hub hospital in Chennai or Hyderabad, we will install the ECGs in the neighborhood, in the physician offices and in the small clinics. And the patients who go there for the routine checkup or with a problem, quickly an ECG is done. Apollo Hospital created an heart command center because they wanted to take the responsibility of interpreting for their own patients. So they created the hub by themselves. In fact, it was inaugurated yesterday by Dr. Sangeeta Reddy, in Hyderabad. And through this, the pilot phase, before they agreed to take it to the customers, we did about 7,000 patients. About 709 patients were critical, and abnormal was about 58 patients who needed immediate intervention. But this is not just the fact where we could intervene early in the golden hour, and they could quickly bring the patient, send the ambulance and bring the patient to the nearby hospital, their main hospital, to provide care. Look at the number of, we had about 30% of these, who were seen early, who did not need immediate treatment, but certainly needed the next level of diagnosis, which is an echo or a treadmill test, which they had to go through. And through that, diagnosing early, you are able to, predict early and avoid the treatment or avoid the, risk rates associated with, a post, complication, intervention. So this was a significant move, and Apollo Hospitals has already around the country installed about 100 such. They want to all the way go up to 5,000, looking at how this will work. And this is the social cost. They're not going to charge for these ECGs, but obviously as the treatment provider, they are able to intervene early and live up to their motto of wanting to be responsible for prevention and thereby reducing cost of echo. And as a company, GE had products, other companies do have products, but we created this ecosystem. We created this connect, and through this, we are able to bring in a change. And of course, this is now, I'm just talking about one big example, but this is now getting very popular. And I'm sure, the adoption rates will accelerate as people see the efficiency of this really able to connect the patient, the physician, the treatment center, and all of them efficiently to reduce cost of health care. To give you another very interesting example, most of us who are married have babies. I don't know how many of you know that it's very important within the first 7 days of your baby's birth to check for hearing ability of the baby. It's mandated by World Health Organization that every baby born has to be screened within 7 days. It's a standard of care anywhere else, I'm sure in the UK and the US and everywhere. And in India, there's been a lot of push from the government. NRHM is making it a mandate, but adoption rates are very, very poor. Why? It's not because the test is expensive. It's not because we don't know the importance of this. It's a very, very important test. When we talk about screening, early intervention, it's a very, very important test because the baby, is able to learn language, brain development is only going, and speech. All of this are basis what he or she hears. The more you delay, if the baby has got a hearing defect, and you will be surprised, 5 out of 1,000 babies in India are born with hearing defect. It's a large population. If you miss that, it's a very simple device. You need to put a ear plug, which transmits sound and reflects back sound. And in 2 minutes, the test is over. It's a pass or a refer. Okay, if it's a pass, the baby is okay. If it's a refer, it has to be referred for diagnostics and for intervention. And the more you delay this, and if you don't do it before 3 or 4 years, or even 5 years, the more you delay this, that is, if it's total hearing, as early as possible. If it's partial hearing defect, there can be an infection or there can be some condition which can be treated. The more you delay this, the learning ability, the ability to speak, all of this is going to get affected. Brain development is going to get affected, and it is irretrievable. And beyond a point, whatever you do to intervene, the baby will grow in the normal course, but impaired by brain development, and it's a big burden. The baby itself is a burden. It's a big problem for the baby itself. Why would it have to go through that? For no fault, when there's a technology available. So now, government in India and many state governments are rapidly wanting to adopt this. And one of the progressive state governments that we have, is the Tamil Nadu government, which about a year back decided to mandate it for all babies. Karnataka has also mandated it. They have done it even one step, with a foresight of before school. Every baby will have to be screened. If you missed at birth, at least before school, you need to have your baby screened, so that you can intervene early. So what we did here, we imported the screening technology. We brought this to the country, and we partnered with treatment organizations. Like in Chennai, there is a treatment organization called MUF. There are private hospitals like Cloud9 and so on and so forth here in Bangalore, Apollos of the world, who buy the equipment and to provide this service. But when it has to go to a larger base of population, babies who are born in the government hospitals and who may not have access to this. This is where government comes into play. They mandate this service, and we do a private-public partnership mode, whereas we partner with the treatment provider who will do the screening and also treat the baby, if it's found to be having a hearing problem. So here we continuously partner with government, with NGO organizations as Rotary Club, to be funding this, because again, somebody needs to fund all this, even if the cost of test being smaller. But from our perspective, we don't just sell to the ones who want to buy, but we also make sure that we do a private-private partnership where on a pay-per-use basis, for every test done, a small amount of money is paid back to us, so that this can be broad-based. Because if you want everyone to buy, it's going to take a lot of time. If you want everyone to be able to use this, train their manpower and use this machine, it's going to take longer time. But the problem already is there. And with this problem, if you have to quickly intervene, we have to disrupt. And one of our disruption is through the commercial enablement by moving away from transactional selling model to pay-per-use models, which is expanding access. So now, clearly when we screen early, our ability to diagnose early happens, and certainly the treatment becomes better. And now, quickly I will close with this slide on Ayushman Bharat. This is a great effort by the Government of India. Of course, very early in adoption stage, just launched last week. Of course, the reimbursements apparently are not to the expectation of the hospitals and the doctors, but those things will evolve, and my belief is if you make it more efficient, the cost will come down, and if cost comes down, reimbursement does not become a factor. So what is Ayushman Bharat? I'm sure most of you know this. It's about expanding access to more people for healthcare. It's the first step in government's first step by government to expand, to move towards democratization of healthcare. 10 crore more families are going to come in. A lot of states have empaneled, and they have combined their existing state programs along with this. And now, what they do very well about this is, they are going back, re-emphasizing primary healthcare focus. Ayushman Bharat is two things. One is, at a primary healthcare level, can we do screening? Like Tamil Nadu government does 25 screening parameters. And the Ayushman Bharat program mandates cancer screening for women, oral, cervical, and breast. For all women more than 30 years of age, they have to be screened for cervical cancer, or breast cancer, or oral cancer. For hypertension is one of the areas where your ECG and your blood sugar levels and cholesterol levels are being screened. And apart from this, there's a lot more screening tests that are available at the primary healthcare center level itself. Now, is it available in all the states? Definitely not. Why? Because just by government, they can only go that much. But we need to come in as private providers, which is hospitals who treat. That's one of the things that they are including. They're asking hospitals to take ownership of running the primary healthcare centers, because the treatment is going to be provided by them. So it will be a good opportunity to connect that system of primary healthcare system where it's already available. The infrastructure is available by the government. Technology companies like us can certainly play a role in partnering, not just in transacting, but in partnering with models of PPP. And the private providers can come in there, bring in the staff, train the staff, and through the technology that we have, through which we liquefy expertise, we can connect, we can create hub centers like what Apollo has created, to get those ECGs from those primary healthcare centers, read it, intervene early, and be more efficient and effective about healthcare. So for all of this, I'm glad that, when 3-4 years back or 10 years back, when GE decided to come in India and look at healthcare for all, we didn't visualize government coming in as strong. We were actually thinking that private is going to take the lead. And private is the place mostly which takes the burden of healthcare delivery in our country. But now with this government program coming in, we're glad that we are ready. We are there in every district, about 400 districts we are present. We have already created a digital backbone. We have, deployment models as what I shared with you. And we're continuing to evolve this to rapidly integrate with the government program. We are even quickly, we are creating an IT app, which will, IT-enabled app, which will allow the health records to be available everywhere. Because thankfully, Ayushman Bharat is not about a program that will only be covered in Karnataka. If I'm a patient in Karnataka, if I go to Delhi, and if I have a problem, I can walk into a hospital which is empaneled here, and my records will be available as well. A lot of IT involvement, is being mandated by the government in all of this. So truly, this has been a very enriching experience. I'm glad that, with the experience that, GE brings in and all of us bring in through our personal experiences as well, we are trying to truly embrace disruption. And embracing disruption, I believe, totally is the first step towards doing something very big. And democratization of healthcare is a big move. And the reason I had to take examples to explain this is because most of you, I'm sure, know about this. But then when we put all this together, it will give you a, complete view of, what we ourselves are responsible for when it comes to our own healthcare, what we can tell our friends through the knowledge that we have, and what we can do as technology companies, and what we can enable as adoption rates in those hospitals, and also the partnership with governments to be able to truly achieve our goal of healthcare for all, which is universal healthcare. So this is all that I have from me, and our belief in GenWorks is quality healthcare at affordable levels is only possible through access, improving access, which we discussed, and bringing in relevant technology at the point of care, and liquefying expertise. Because all these are the problems that we have to bring together to solve the problem. Otherwise, we'll just be creating problems. One thing I always believe is, coming from the technology background, technology in any form should only solve a problem for it to be merited. It cannot create a problem. Technology can create problems if you don't connect it, to the delivery and take accountability for the delivery. And accountability of the delivery can only happen if we connect the ecosystem and finally look at the patient. Finally look at the public who's getting that delivery of health care, who's getting the treatment, and are they able to get it effectively and efficiently is the way forward. So that's all from me.